The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all listeners and viewers. Welcome to the Health and Fitness Show. I am your host for today, Suliman Rafiq, and we are broadcasting live from the studios of Inspire FM today on Thursday, the 15th of August 2019. Casting our positive vibes across Luton and surrounding areas, as well as reaching listeners via the Inspire FM website. If you prefer to watch as well as listen, you can do that via Facebook. All you have to do is go to the Inspire FM Facebook page and click on our live link. And I would like to take this opportunity to wish everyone a belated Eid Mubarak. Hope everyone enjoyed themselves, and Jazakallah to everyone that was involved in the Inspire Eid and the amazing fun-filled activities at Lucy Park. It was great to see so many of you. Before we go on to today's topic, I've been asked to say your help is needed to secure a healthier future for everyone in Luton. Earlier this year, NHS England set out its long-term plan. Health bosses in Luton, along with Bedfordshire and Milton Keynes, are now developing their own local plan and would want to hear public's views on what is important to them about the future of health and social care services across Luton, Bedfordshire and Milton Keynes. To help secure a healthier future for everyone in Luton, we're asking you to complete a short online survey at www.blmkpartnership.co.uk/good ideas. So, as you know, we cover different health topics each week, and today's topic was actually suggested by a listener, and it's in regards to fertility and pregnancy. Now, today's show is live, and the reason we do that is to allow you to get in touch, and you can do this by text or WhatsApp on 0777 948 1822. That number again, 0777 948 1822. A recent report from The Guardian outlined that of couples trying for a baby, 84% will conceive naturally within the first year. Others after a little more time, but many continue to have problems. In July this year, a wellness company was forced to withdraw a £250 fertility boost after the British Pregnancy Advisory Service highlighted the product's lack of proven benefits. It accused the company of causing real damage to women's emotional well-being. The UK fertility industry is estimated to be worth more than £320 million and is growing all the time. An expensive vitamin drip that ironically contains ingredients that are all available and more easily absorbed in a balanced diet is just the tip of the commercial fertility iceberg. Ensuring that women and men achieve and maintain good health in their reproductive years is a public health challenge that impacts on future health for both themselves and their child. Now, I'm delighted to be joined by a range of local and national guests who will be providing expert advice and relevant guidance. So I'm going to start with our guest who's joining us on the phone. Anya, can I just ask you to introduce yourself, your role, and a bit about your organisation?
Yeah, sure. So my name is Anya Sizer, and I'm the regional organiser for a national charity called the Fertility Network. And we support people at all stages of the fertility journey, but more specifically when people are struggling to conceive or coming to the end of treatment or going through treatment. We're there with a range of services and ways to support and help patients.
Fantastic. Thank you very much for giving up your time to be with us this evening.
Pleasure.
Jayne?
So I'm Jayne Pigott, public health midwife at the Luton Dunstable Hospital, and I work quite closely with yourself and Luton Council.
Thank you. Shahnaz?
Thank you, Suliman. I'm Shahnaz Akbar. I'm a consultant gynecologist and obstetrician, as well as a specialist in reproductive medicine and surgery. I am based at Luton Dunstable Hospital as a senior fertility clinician, and I work privately at Spire Harpenden and One Stop Doctors as well.
Great, thank you. And last but no means least.
Hello, Suliman. I'm Linda Masterson, and I'm the UNICEF Baby Friendly Initiative Coordinator for Luton Community Health Services, mainly working with the 0 to 19 team. And I'm very proud to say that Luton health visitors are fully accredited with the Baby Friendly Initiative Award.
Great. Thank you all very much for your time this evening. As I say, listeners, this is a live show, so please do get in touch. We've got a range of different guests who are happy to answer your questions. That number again, 0777 948 1822. It's 0777 948 1822. Okay, so today's topic is in regards to fertility and pregnancy. Shahnaz, if I may, I'm going to start with you. What do we mean when we use the term fertility?
Suliman, thank you. The fertility actually is production of offsprings. It can be defined as the natural capability to produce offsprings. And when there is a lack of fertility, it is called infertility. And in the United Kingdom, almost 1 in 7 couples suffer from infertility, and there are various causes which we'll be discussing in details later today in this program. But roughly 1/3 of the couples have no cause, and which is called unexplained infertility, which could be related to stress, which we will elaborate more further. And 1/3 of the causes are due to male factor, and remaining 1/3 and over are due to female causes and combination of both male and female.
Great, fantastic. And it's interesting to remember that it's quite equally split across male and female in relation to some of the issues that we'll be talking about. Anya, if I may, I'd just like to come to you in relation to just expanding on some of the causes, diagnosis and treatments in regards to infertility.
Yeah, certainly. So it's a very common issue, and I think for couples when they're facing infertility, it's really worth remembering that it is 1 in 6 or 1 in 7 couples in the UK that experience infertility or subfertility, as it's sometimes referred to, and it can be a huge range of issues that cause this. It can be on the female side, anything to do with ovulation or implantation issues. It can be anything to do with maybe having left it a bit later in life and egg quality issues. And then, as you so rightly said, actually, it is about a 50-50 split in terms of the causes of infertility and whether it being female or male fertility. Yeah. So men experience about 50% of the issues as well at the moment. And that can be anything to do with sperm quality, semen issues. But it is worth noting that, yes, certainly it is as many men as women facing fertility issues at the moment. And so there's a wide range of issues. There's some great testing that is available for people and a range of ways to treat infertility. So I would always encourage couples to try and find out what the issue is, if possible, and then to seek as much medical help as possible.
Right. And I saw on your website today, just in relation to secondary infertility, can you just explain what that means?
Yeah, absolutely. And thank you for bringing that up, because actually it's an issue that's not always talked about. But we are seeing a rise in secondary infertility where perhaps a couple have conceived maybe easily the first time and then go on to experience issues, or maybe they have had issues the first time round and then still have issues having a second or maybe even third child. And again, this is an issue that we're seeing increasingly because people often are leaving it later to have children, and then finding that maybe the first one comes along fairly easily, and then the second one, because of the age issues, that there are problems with that. And secondary infertility often is met with a lack of understanding by people and a lack of sympathy sometimes, because people will look at a couple and think, well, you've got a child, surely you should be content. But actually the desire for a family, for a second or third child, can be just as strong, if not more so, with secondary infertility. And it's important, again, to seek medical but also emotional help for this issue.
Sure. Jayne, I'd just like to bring you in now from your perspective as a public health midwife. What can you tell us in relation to preconception care?
So preconception care is related to the period pre-trying for a baby. So actually some people think it's actually when you're trying to fall pregnant, but actually it's a lot of getting yourself in the right in the healthiest form to fall pregnant, because that will then help you, especially men, to have the best quality sperm. So when you're talking about the infertility and struggling to conceive, if you are at your healthiest when you fall pregnant, it helps you in pregnancy. The strains that pregnancy puts in your body, if you are healthy when you go into that pregnancy, obviously it's going to help you in pregnancy. So it's really key that we make patients or potential pregnant women and their partners aware that if they are healthy, they're going to help themselves in the long term in the pregnancy.
And when we say healthy, what exactly?
Not overweight,
Okay.
Or ideally limiting the how overweight you are, or at least getting some help into trying to reduce how overweight you are, reducing your smoking, or ideally for pregnant women stopping smoking, but obviously getting in the right direction, limiting your alcohol intake, exercise, making sure you're at your kind of physical, not prime, but at least there's a healthy get out there and get walking for your 30 minutes 5 times a week. So you're taking on the adaptations that everyone kind of advises for the ideal kind of outcome that you want to achieve.
Sure. And how important is weight? I know smoking is often I think it's quite well understood.
Yeah.
Because it's even on the packets and stuff, isn't it? How it causes infertility and this kind of thing. But in relation to weight, I mean, does that really have an impact?
Yeah, because it's hard when someone falls pregnant. You can't then say to them, you've got to go on a diet, because your body needs all the nutrients and goodness from foods. And it's not a case of eating for 2, it is eating nutritiously and healthily for 2. But it's already, if your body is already overweight and then you add a baby into the mix, you're going to then have more blood volume going around your body, and it puts a lot of strain in your body, puts a lot of strain in your heart and your lungs. So if you can put yourself in a peak condition prior to it, you're not putting as much strain on your body. You do have an increased risk if you are overweight in pregnancy or prior to pregnancy for complications. You're more at risk of a miscarriage, you're more at risk of a stillbirth, unfortunately, and you're more at risk for complications in pregnancy like diabetes or other kind of potential obstetric risks. So therefore, if you can get yourself in that prime, and then it's going to help. We're not saying be amazingly fit and healthy. I'm not saying go run a marathon before you get pregnant, but make sure you're eating those healthy foods. You've got used to that kind of diet. You've got used to going out for a walk. So your body is in that supple, ideal situation to fall pregnant in, rather than kind of being on the back burner and having to catch up.
So it really it's a proven kind of impact in relation to if you improve your diet and doing physical activity, that has a proven impact in relation to fertility for people that are looking to. Okay. And I just want to come on to a point that was touched on by Anya. Shahnaz, I'll start with you if I may. It's just in relation to one of the reasons why we're doing this topic. It was suggested by a listener, and I know of friends and family and stuff where they're struggling to have children, and what are some of the reasons for, often it's felt because people are leaving it later in life. Does the data actually show that being impact?
Yes, Suliman. As we all know, most of us are having children later in life. That could be because of various reasons like education, jobs, careers, establishment before they want to have a baby. However, this is very important to realize that woman's age is a crucial factor in reproduction and conception. And there is evidence that a woman's peak reproduction years are between late teens and late 20s.
Right.
And fertility starts to decline by age 30 years of age. And this declines become very fast over when woman reaches mid-30s. Additionally, by age 45 years, it is the fertility declines so rapidly to the extent that getting natural conception is very difficult for most of the couples. So yes, that is one of the factors. And there are other factors which are associated, but my advice is to start, if you are thinking of having a baby, then don't delay it. Then to start as when you are healthy and fertile. So my advice is, as Anya has mentioned and Jayne has mentioned, that as soon as you are trying to think of having a baby, make sure you are fit and healthy. If you have any doubts, then contact your GP to make sure the proper health checks are done, especially the BMI, weight, alcohol, drugs, any medical problem or any gynecological problem or to the male any factors.
Someone once said to me, like, you plan for a wedding, you plan to move house, you need to plan for your pregnancy, there needs to be preparation for it. Otherwise, you are kind of going in blind. And don't get me wrong, well, I had a baby and I didn't plan for it, but now obviously knowing what I know with midwifery and how it can impact, it's so crucial. And it's not, as we're not saying kind of become the healthiest person you can be, but be aware of it and limit the risks that you're going to put yourself at.
And like planned pregnancy is a term that's often used. Yes. What exactly do we mean when we say that?
A planned pregnancy is, not everyone's going to plan a pregnancy, but if you are thinking about getting pregnant, think about how healthy you are. Could you do anything to help yourself? Also get yourself checked, because there's certain conditions that with the genetic conditions that can be passed down. Make sure that you're actually in a situation where you haven't got any or checks that you can have done to make sure you're in kind of an ideal place.
Sure. Yes.
I also add that people have a belief that we can delay our pregnancy whenever, doesn't matter. IVF is still there, but we need to remind everyone that IVF also very much revolves around the woman's age. It's more good chances in mid-30s. After that, it declines very drastically. So we need to make everybody aware that IVF is not a magic, doesn't matter whatever age, but it declines as the natural fertility declines with age.
Sure. And so for any listeners that might not have heard of IVF, can you just explain what you mean by that?
IVF meaning in vitro fertilization, vitro meaning outside the body. When the woman's eggs are taken by stimulating her ovaries, because a woman usually produces 1 egg and occasionally 2 eggs, but we stimulate her ovaries to produce more eggs, take the eggs out. And if the sperms are healthy, moving fine, good in numbers and shape and size, we meet them together in the tube. That's why it's called test tube baby as well sometimes. And if the sperm is not moving or less in number, then we select the best one, inject into the cytoplasm of the female's egg. And when fertilization happens, an embryo is created, which is the future baby. And then the embryo is placed back into the woman's uterus with other hormonal support. And after replacement of the embryo, 2 weeks later, we do a pregnancy test, and then she becomes as normal as anyone else conceived naturally.
Right, okay. So it's in relation to that beginning stage test tube. People might have heard it referred to as test tube baby.
Yes, because the fertilization is happening in the tube and it's outside the body. That's why it's called in vitro fertilization.
Sure, that's helpful to understand that. And Anya, just in relation from your organisation's perspective, is age predominantly the main kind of factor that you see, or are there others?
Well, age is one of them, but I do just want to say that although age is a factor, what we're finding is it generally isn't about people delaying it for a career or anything like that, but actually people are often finding partners later on in life. So I
Exactly.
just want to
Yes.
make that point because I don't want to make anyone feel blamed that they've been, following a career path, and that's the reason why. Actually, often the delay is to do with finding partners later in life. But medically, we're seeing so many different reasons for infertility. I mean, we've known people have issues with their egg reserve as early on as late teens, and we've had men that we've known who've had issues from early 20s with sperm counts. And so there's a wide variety of reasons that people end up having to use fertility treatment. But for each couple, it really is a very big process to go through, and a lot of they assumed would be quite an easy process. A lot of the time, people generally assume that they'll find a partner and conception will happen quite easily. So there's often a real shock for couples and a huge amount of sadness. We did a survey a few years back about the emotional impact of infertility, and we found that 90% of those going through infertility actually experience depression at one point or another. So this is an issue that really does hit couples very hard, and support needs to be found.
And just I'm conscious we're fast approaching our advert break, but Anya, just sticking with you in relation to the support groups and what's available for people, for listeners that might have some concerns.
Yeah, thank you. So Fertility Network run huge amounts of support. So we've got lots of handouts that you can download from the website. We run a really, really well-regulated community board that you can go and just meet with other people on called Health Unlocked. We have a helpline and we have a support line, and then we run regional support groups where you can meet people in person that are going through the same. So please just go to our website, Fertility Network UK, and there's lots of resources, lots of support, and you don't need to feel alone.
Fantastic. That's really helpful. Thank you for sharing that. Shahnaz, I just want to come in regards to specifically, you've joined us from the Luton and Dunstable Hospital. And what has been your experiences locally, and what services are available locally for Lutonians?
Yes, we do offer a very comprehensive service. We have a dedicated fertility IVF center at Luton and Dunstable Hospital, and very dedicated staffs, and one-to-one care, and we offer personalized treatment care to them. As we just discussed, that fertility is a very distressful condition, and couple, they go into a vicious circle of stress, and sometimes it's very difficult to break. So we have emotional support as well. And we also discussed earlier that sometimes there are weight issues, BMI, smoking. So we have developed links with Luton Total Wellbeing for local people, where they can have weight management and emotional support. And also, I'm very proud that we have introduced a smoking cessation program, and a lady called Maureen from Luton Total Wellbeing comes and helps the patient there and then. So that is the support offered. And then because people before Luton, people were traveling far distances to have IVF treatment. So I'm very proud that we have this unit, so they don't have to travel every visit. They only go 2 visits to Bourne Hall, Cambridge, and we do all the satellite work, and we have excellent success rates.
Sure, and hopefully after the break we can pick up a bit more about how residents can then be referred to your service and how they can engage with that. Anya, I just want to come to you in regards to, we've spoken a lot about the impact for women, but for men specifically, what advice is there?
Yeah, thank you so much again for bringing that up, because I think men are so often overlooked in this. And as we've said previously, actually often it's about 50-50 in terms of the reasons for people seeking out fertility treatment. So the first thing that I'd want to say is that you are not on your own, and men deserve just as much support as women. Men grieve, men really have a loss of identity a lot of the time. So please know that support is out there. There's a fantastic group that is run, a closed Facebook group online that men can access. It's only for men, and it's totally private, and it's a great way of connecting with other men going through infertility.
How would you get onto that?
Yeah, so contact Fertility Network UK and we can share the resources for that. We've got, again, handouts, support online for men going through it, and watch out for Fertility Awareness Week, end of October, beginning of November, because we will be dedicating some of that week specifically to the male perspective. But it's something that we're starting to see men talk about more, which is fantastic, and there's been some brilliant male spokespeople talking about their experiences of male infertility, and I think the more and more we see men talking about this and breaking the taboos, the more we'll realise that men really do deserve the emotional support when going through infertility.
That's really helpful. Thank you for sharing that. I noticed there are also some resources in relation to advice for people that may have family or friends that are struggling, and what's the best way of supporting them as well. So it really is fantastic to see how wide-reaching your advice is. So if anyone does have any concerns, then they can see the website. I'm just conscious we're approaching our advert break, so after the break we'll pick up this conversation more, so please do stay with us.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm Suliman Rafiq, your host for the evening. And in the first half of today's show, we've been focusing on infertility or fertility. And we're going to continue that discussion because we didn't quite finish it. And then we'll be moving on to discuss more about pregnancy and post-birth and Free to Feed campaign. So thank you very much to our guests for giving up their time to be with us. Could I just ask you to very quickly introduce yourselves for anyone joining us now?
I'm Jayne Pigott, public health midwife at the Luton Dunstable Hospital. I'm
Shahnaz, Akbar, consultant gynecologist and obstetrician at Luton Dunstable Hospital and fertility specialist senior consultant.
Linda Masterson, I'm the UNICEF Baby Friendly Coordinator for Luton Community.
That's great. Thank you again for your time. So listeners, this is a live show, and so the reason we do it live is so you can ask us any questions you would like to. You can do that by calling or WhatsApping us on 0777 948 1822. That's 0777 948 1822. I was interested to see we've got one listener from West Africa, Ghana.
Oh, wow.
Yeah, so that's quite nice.
We've not got any questions yet, though.
No questions specifically. Just one person reminded me that I needed to mention about men. Which we have. So, but flying the flag for men out there, which is nice in public health. Absolutely. So, Shahnaz, I'd just like to come back to you in relation to, we were discussing how fortunate we are now to have a lot of services on our doorstep at the Luton Dunstable Hospital. Can you just clarify how someone would actually access those services?
Yes, because it is an NHS trust, the couple who are struggling or are worried about their fertility, they should contact their GP. And usually it is advisable to them that if they're young and healthy, no medical problem, no concerns, then they should try naturally for 12 months. And more than 85% or 90% will conceive during the first 12 months. And the remaining 50% will conceive in the second year. But if they have concern, and especially as I mentioned earlier, if she is in mid-30s, she should be referred straight away to the fertility consultant in our center, and we accept referrals from the GPs all around, and patient has choice as well. And when they are referred, then they are seen. And especially even if they're young and healthy, but previously, if they have any conditions like sexually transmitted infections or treatment of cancer or any surgery or any gynecological conditions like polycystic ovaries, endometriosis, fibroids, or in the male, because as we are discussing that we always forget the male and we always focus on the female, but sometime in the male case, if there is some injury to the testicles or any tumors or undescended testicles or surgery or any infection, they should seek and then be referred to us. But privately they can self-refer.
Privately they can self-refer as well.
And I accept self-referrals.
Fantastic. And so just to be clear then, if someone is worried about their fertility, they should try for 12 months, is that right?
No, it's not like one fit for everyone.
Right, okay.
Everybody is an individual.
Yeah.
As I said, generally, if they are young and healthy without any medical problem or condition that we discussed, that if they're trying to conceive, then they should have a preconception checkout, meaning that they should not be smoking, alcohol, drugs, medical problem or any surgery. And if they have checked with the GP, ideally should, before trying, to make sure they have checked with the GPs that their vaccinations and everything is all up to date. Then they are advised to try naturally, have regular sexual intercourse 3 to 4 times a week without stressing, without checking temperature, ovulation, which cause more stress. And they should also know that in young healthy couples, under 30, mid-30s, and there is a 1 in 4 chance couple will get pregnant each menstrual cycle, so it's not still 100%, so they should not get stressed. And when they get they don't conceive within 12 months, they should be referred to us. And then, as I said earlier, if there is any definitive cause for subfertility or infertility, like infections or surgeries or gynecological or medical problem, they should be referred straight away to us. And if nothing is wrong, even if she is mid-30s, she should be referred straight away.
Sure.
No matter how old is her husband or partner.
Right, okay, regardless of that.
Yeah.
Okay. And then is there we've spoken a lot about the age of the woman, but is there anything in relation to the age of men, or does it not quite work like that?
There lots of recent studies are coming up, because the couple said that why you always ask about the women's age and not, because women they are born with fixed number of eggs which decline with age. And after 40 years, the quality and the quantity goes down. But studies have shown in male around 80 years of age, the testicles contain about 10% of sperms, and at 20 to 39, 90% of all the follicles in the testicles contain sperms. So the male factor, yes, it declines, but it's not a hard and fast rule. If male is having any medical problem like diabetes, blood pressure, or any medication, smoking, or any recreational drug, then it affects.
Sure.
But age is not a crucial factor.
Sure. And you mentioned about stress, and specifically about the like a lot of people have like calendars and like you say, taking temperatures, and
it's
like
not advisable,
time of days and all kinds of stuff going on. So that is not, because it's quite common, isn't it?
Yeah, because if they are she's healthy and happy and not stressed about anything, and not focusing on just that she's trying to conceive, and then they automatically develop themselves into a mode of stress, and which goes into their system, and they live in a mode of stress, and it's very, very difficult to break that vicious circle. So that's why it is advisable that, yes, before trying conceive, have a checkup, make sure there is no cause which will be affecting their fertility, like weight, BMI, smoking, medical problem, vaccination, any previous history of sexually transmitted infection or any, then they should be happy and relaxed. And I strongly discourage that, to check their temperature for ovulation and then say, my egg is there, where is my partner, I need to catch egg, that sort of thing. It shouldn't be. And also don't get obsessed that I'm trying now and in 3 months my period's coming, and as soon as they are trying and every month they get so distressed and upset. No, they shouldn't, because as just mentioned earlier, even young healthy couple, there is 1 in 4 chance, 1 in 4 couple will get conception in each menstrual cycle.
Sure. That's really helpful. Just before I move on, is anything else you want to add in relation to fertility or infertility from our guests?
Stress. I'm interested to know, does stress affect your fertility? So when you say about not getting stressed, if you get stressed that you're not pregnant, then you get extra stressed. It's not a help. It's
a vicious circle. It's a vicious circle. So that's why I reassured them, and I talked to my couples, and that's when I was having fertility training. I realized that I can't cope, so I went to South Bank University as a part-time student to have counseling skills.
Right.
So degree. So I listened to my couples, and most of them, they say, when we come and talk to you, we get pregnant because they calm down.
But the pressure also of the families and friends around. You know, if your friends and your relatives are all having babies, and
you just got married, they expect the baby next.
And it's very difficult, isn't it? That adds to the difficulty.
Yes, like most of my couples mentioned that my sister has a baby and I can't go to the christening, and also this all is stress. So I talk to them, reassure them, don't compare with anyone. And sometimes they don't go to social gathering like birthdays and things. So this should be, and we offer counseling as well, and I talk to them. And most of them, they are very happy and successful.
In that first instance,
it's like a grieving, isn't it? It's like a grieving process. You haven't had something.
And sometimes
something you feel. You get married, and it's a normal part of life. It's the norm to get married and have a child, and then suddenly it doesn't happen.
And also sometimes in our community here, family pressures. That's very, very important. And I've seen couples after 2 months of trying. I'm getting stressed. Baby's not coming.
2 months.
I've seen. So I have to talk to them.
I had a friend that was getting married, and before she's even married, she started to get stressed about falling pregnant. I was like, "What are you doing? You're not even married yet." Calm down.
So when I talk to them, reassure them. When I talk to them, reassure, listen to them, and make sure everything is okay. And they come, "Oh, you were right, and we are happy, fine." So they need to relax and not to delay.
But they are trying. They need to take folic acid as well, though. That's one thing we did mention before. Folic acid is really good.
And make sure they are she's immune to rubella and not having any other medical condition. And make sure all the checks are done.
But don't expect everyone to remember all this stuff. Remember, they can go to their GP. They can speak to their nurse. They haven't got to know all that. We know the stuff that we're talking about at the moment, but go and seek some support. So if you don't know and you're worried,
and ask.
Go and see your nurse or a GP or ring the maternity unit. We can advise what direction to take.
And the NHS website as well is quite. I think recently
Tommy's is really good as well. Tommy's has a preconception area on there, which is really good. And it's done on the back of a lot of research, and so Tommy's is really good. And we went for a lot of women to look at the Tommy's website, but the NHS one is actually is very good. A lot of information on there.
And also,
I don't know whether they translate it into different languages, but I'm pretty sure you could probably find something on there that might cover another language.
Or Google Translate.
And also advise that if she's suffering from diabetes or any medical condition, make sure all is stabilized before her trying to conceive.
Okay. Just thank you to our listeners. We've just got some comments, questions. Folic acid ?
Folic acid, definitely.
So what is the
preconception and up to 12 weeks of the first trimester? It
so how do you increase your folic acid? Sorry, ignorant.
Take a supplement.
Oh, you take supplements.
So you can take a supplement of it. Pregnant care includes it within it. So but you don't have to take a pregnant care. You can take any kind of folic acid.
I usually advise when you're trying to conceive to start taking healthy living style, healthy diet, fresh fruits, vegetables, and pregnant care for conception. And then during pregnancy, if needed, pregnant care for pregnancy and lactation.
And are there any foods that have that in, or is it just a supplement?
All the tomatoes, oranges, colored green vegetables, fruits, and healthy fresh fruits and vegetables.
So you get the Healthy Start vitamins in Luton as well. So once you're pregnant, you can then start taking the Healthy Start vitamins, which are really key. And just keeping you healthy again through your pregnancy, so making sure you're covering all your angles, and then you're going through. And once you're pregnant, it's also the vitamin D supplement as well. So
and I think the important thing to remember is that you do need to take the vitamins all the way through. It's not just the one packet that you get initially. You must take it every month,
and also balance with healthy diet and exercise and no
even
smoking.
It's much better than just sitting there and thinking, I'm pregnant, I've got to sit here, and your joints seize up and your movements then are more difficult and stuff like that.
And stop smoking and alcohol and
And so we've kind of naturally moved on to talking more about pregnancy. So all being well, the lady will fall pregnant if that's what she wants. I'm just conscious, you actually have a clinic this afternoon, don't you? So you'll be leaving us shortly.
Yes, I'm sorry.
No, not at all, not at all. I really appreciate your time and your input. So I know you've got a few more minutes, but I'm just conscious that you will have to shoot off in a minute. So just moving on in relation to pregnancy and having a healthy and happy pregnancy. Jayne, just coming to you now, what are some of the signs that a woman may be pregnant?
So, well, the main one would be the fact they miss their period. Obviously, it would have been an obvious one to show that you're pregnant, but you might get other symptoms, you might feel sick, might be a bit nauseous, you might actually be sick, tender breasts, you might find that you wee a lot more, you might be quite hormonal, maybe constipated as well. Unfortunately, all these lovely side effects of pregnancy, but and you might feel quite tired. So actually, you fall asleep and you're very exhausted. It's not a case of you just going to bed; you are actually exhausted.
And also, if she's having regular periods and she suddenly have some irregular bleed, she should always check a pregnancy test. So that is very, very important. Yeah. Sometimes they have irregular bleeding during pregnancy, and if they had irregular periods previously, they think this is it, but they need to do a pregnancy test.
Yeah. Great. Always do a pregnancy test to make sure to show you're pregnant. Yeah.
And you mentioned earlier about some of the support that's available through the Total Wellbeing program that you're involved in. So can you just elaborate on that for us?
So Total Wellbeing for us in Luton is fab. It supports all women in pregnancy with the Stop Smoking service. Maureen is actually for the fertility, but she also covers pregnancy. She'll see women all the way through. We're doing some work around some collaborative working with midwives and the smoking cessation service, and then we're linked quite closely to Total Wellbeing's weight management service. But in pregnancy, it's around being healthy. We're not trying to get you to lose weight. We're trying to make sure that you're eating healthily in pregnancies. They've got 10 key steps or key parts of advice they want you to do. So they want you to start with a healthy breakfast, start your day off well. They aim for you to mix your five a day for your fruit and vitamins. That they advising you to make sure that you're taking food from all of your 4 main food groups. You're choosing nutritious snacks rather than the fatty, salty, sugary snacks. You're keeping active, but if you haven't been active before, it's not saying that you can't then increase yourself up to this physical activity, ideally 30 minutes 5 times a week. But it's getting out there, getting some fresh air and getting your body moving, because it's going to take on quite a lot of, with that blood going around it and the pressures. Be aware of the food safety in pregnancy. You've got a lot of foods that you can and can't eat, and the best way to refer to double check that is the NHS website, because it does change a little bit over time, but mainly be aware of food safety. You don't actually need to eat more in pregnancy. In the first and second trimester, it's not eating for 2. You only need an extra 200 calories in the third trimester. So when we say the third trimester, it's the latter part of pregnancy.
But you still hear that so often, don't you?
Yeah, eat for 2. No, you don't. Really, you don't. Stay hydrated, take your supplements, and seek support if you need if you need some support for the alcohol input or your mental health and bits and pieces. You are going to struggle in pregnancy. It's a difference. You're going to have the pressures from family. You're going to have a lot to seek support. But the weight management service, they actually run a weekly program where they get women together and they discuss all of these, and they teach women how to choose the right foods, look at labels and make the right choices, which will take them on in life for choosing foods for their children. They do a little bit of exercise, and there's midwives go along. We have midwifery sessions. So actually I can ask midwives about bits and pieces in there. They also run the aquanatal, which is good exercise in pregnancy because your body weight is lighter, so you can do your exercise without straining your body. And they're just a very good support, and you don't get that in every area. We're very lucky in Luton to have that support.
Yeah, absolutely. Shahnaz?
I just wanted to inform that we are hosting a big event in collaboration with Luton Total Wellbeing, a fertility event for the public.
Okay.
Within few months. We are in the process of organizing.
Fantastic. Yeah, we'd love it if you could share more details about that once it's been arranged.
Yes.
That sounds really interesting.
So the Total Wellbeing sessions for pregnancy, they run on a Monday at Lucy Sports Centre, and they're 6 till 7:30 p.m. They run them on a Wednesday at the Inspire Sports Village, and that's at 9:30 to 11 a.m. And they, as I said, they run the aquanatal, which is £5.70 a go. But if you're on any other programmes like Me Time Family or on our weight management service, then you can get that for free.
Sure.
And then they're looking to add sessions to it, but we need women to come to these sessions and take advantage of them to make them better, and get to know people in your area, and share good tips, bad tips, what they found good, and bits and pieces, and actually spread that love amongst each other, really, because you kind of only learn from other people who've been there previously. You don't know what you don't know.
Yeah, absolutely.
So come along and find out what you don't know, because we need women to engage with it.
And so those classes on Monday and Wednesday, they're free?
They're free, yeah.
Okay.
You should be able to be referred through your midwife. But if not...
So you need to be referred?
No, not necessarily. No, they can just come along. At the moment, so if they wanted to go on the Total Wellbeing website, look up the information, or there's a phone number we'll add to this link when you put it up, and the email address. They can email through and just come along, because we want every woman to be healthy in their pregnancy, or as healthy as they can be. We don't want to think about coming along and you're going to get told off for doing anything. God, I can talk about eating healthily. I certainly don't do it all the time, that's for sure. So it's not a turn off session, it's just information, and it's making women understand the benefits of being healthy in pregnancy, because you want the best start for your baby, and you want the best pregnancy for yourself. So we want to help as many people as we can with that.
Great. Shahnaz, is there any last messages you want to share with them?
I wish all our listeners all the best, and thank you very much.
That's great. Thank you very much for your time. And then Jayne, just in relation to when I was looking up about this topic, there was quite a bit around having a birth plan.
A birth plan, yeah.
It's the first time I've heard of that.
So you can plan for a birth, but you can't plan for pregnancy. It's ironic, isn't it? No, a birth plan is once you, I think a lot of women would be honest and say they don't think about giving birth before they go to do it. So therefore you get to that point in pregnancy where you think, oh my God, actually I've got to give birth. And it's thinking about things about what would you like for your birth? Would you like music? Would you like some relaxation techniques? Where would you like to give birth? Would you like to give birth at home in our midwifery led birth unit? Would you like to be on the labour ward because you've got extra doctor input? And what type of pain relief would you like? Would you like to try water?
So these are options you have.
Yeah, these are all options you have in pregnancy, but the woman has to think about what things they would like. It's their preference. It's not us to dictate to them what they can have unless there's certain conditions.
Because often it feels that way, that you as the professional just tell the patient.
There are certain areas where we will, we do. There are safety. It's for safety of the woman that there will be guidance around it. But even then you have different avenues you can take. And we have a great birth team at the Luton Dunstable that can talk you through all your options if there's anything outside what we call the normal, or what might be nice guidance and things like that. But a birth plan would be pain relief. What type of birth are you looking for? Obviously we can't plan how your labour is going to pan out, but you can actually have an idea. And I think mentally, if you're focused on what you would like, you've got more chance of it happening. But at the same time, be flexible. Don't put yourself in that risk category by being so restrictive that you're not then open to the interventions that we need to help you.
Sure.
So some of it might be the way we monitor the baby in labour. It might be the way that you might need to have, there's a little bit, we can perform an assisted delivery, certain things around that type of thing. So and for us it'll be about how after birth as well. We talk about the delivery, but actually afterwards, do you want skin to skin with your baby? Yes, we want to encourage all our women to have skin to skin with. So therefore, we want the women to be aware of that. Once they've delivered, the baby will be skin to skin with them to aid that bonding, to aid your feeding, and the help for the feeding. So it's the whole, and discuss it with your midwife. It's not a thing that you've got to go online and have a look at it and do it all by yourself. Discuss it with with your midwife, so that then you can talk about your options, because there are certain things around it that will be a clinical term that you probably won't understand.
Sure.
And that's for us to answer.
And can I just say, what's really important about skin to skin is that the baby's given the opportunity to stay in skin to skin for a length of time. It's not just putting the baby on and taking the baby off. It's very much about allowing the baby to go through 9 stages of being prepared.
It's just been born. It's just been born. It's come through quite a traumatic experience. It wants a little bit of love from its mum, so it can smell its mum and it can hear its mum's heartbeat, and it wants the bond is so critical in that first couple of hours and days. That skin to skin is imperative.
And ideally, to be in skin to skin, so that the baby can actually achieve its first feed. And we know that if the baby can feed well in skin to skin, the chances of being successful in breastfeeding, that's a really good start to know that the baby's actually been able to achieve that.
And that kind of nicely moves us on in terms of why is breastfeeding so important? Why, for the newborn?
Well, what I'm going to start out with first is really just some information about, the UK has one of the lowest breastfeeding rates in the whole world. And in the UK, about 81% initiate breastfeeding. And by the time we get to 6 to 8 weeks, exclusively breastfeeding is probably down at 24%, whereas any breastfeeding, so people who do mixed feeding, that is around about 50%. However, in Luton, we're actually really very good. Any breastfeeding in Luton, we have a rate of between 58 and 60%. And I think that's due to a lot of the support from the community staff, making sure that the lady gets the
Flying
support
Start,
they needed.
and the
Flying
baby
Start
cafe.
and the health visitor assistance in the community. And we know that the WHO recommends exclusive breastfeeding for the first 6 months of life.
Really?
And unfortunately, in this country, by the time we get to 6 months, only 1% of the population are actually still breastfeeding. So that's quite sad.
Yeah.
But we have loads and loads of research to show us that there are enormous benefits to people's health and well-being, not just to the infants, but actually to the mothers as well.
Okay, so the World Health Organization recommend up to 6 months
Up to 6 months exclusive breastfeeding, and then to start adding in solid foods alongside breastfeeding for up to 2 years.
Yeah, okay.
And 2 years and beyond, whatever women want to do. But we know that there's really a powerful factor in, the research shows that breastfeeding has a powerful factor in infant, not just physical health, but emotional health.
Sure.
We also know a lot more about microbiome and epigenetics and about brain growth, much more associated with breastfeeding.
I'm conscious of time, and I'm aware that I've seen the hashtag free to feed and program. That, can you just tell us a bit about that?
Yeah. Well, the Equality Act of 2010 states that it's discriminatory to treat women unfavourably if they're breastfeeding, and especially in public places. So our aim with the campaign was to encourage women and to support them, to give them the confidence that that they can feed their children anywhere, anytime, wherever they want to. This was a normal practice, and that's our vision of the Free to Feed campaign. And we started it in July this year, and it's really to support women across Luton and Bedfordshire. And we just want to increase that profile of people understanding that it's normal.
Yeah.
It's normal to breastfeed, and it's an okay thing to do in public places.
Yeah, absolutely.
So we've got some videos.
Great.
We have...
we are just approaching the end of the show, so we will love to bring you back on, and we'll discuss that in a bit more detail.
Okay.
Thank you very much, listeners, and see you next week.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.